Got involved with Wraparound due to my son, got caught up in some trouble with the juvenile system.
My mom always told me, like, if I don't listen to somebody, I'm either end up dead or in jail. And that's what happened. I ended up in jail.
Wraparound was there for my whole family. They was able to help us with a lot of resources to keep him on the straight and narrow. And it's helped him with a lot with his anger, basically the essential needs that he needed help with before, that we couldn't get help with before we started Wraparound. It's like they just filled that void with the help that he really needed.
Since I've been in Wraparound, they helped me out a lot. I just learned so much. I learned how to be independent. I learned how to get up and do things on my own. I learned how to be respectful and show respect to other people, and people been showing me respect. I really made progress, because in the past I used to be like, I'm gonna do it, but I wasn't trying to do it. But I actually tried, and I did it, and I achieved my goal.
Hello, I'm Bruce Kamradt, Director of Wraparound Milwaukee. Wraparound Milwaukee is a unique system of care and supports for children whose complex emotional and mental health needs put them at immediate risk for having to be removed from their home and community and placed in a psychiatric hospital, residential treatment center, or juvenile correctional facility. In Milwaukee, we've created one program across child welfare, juvenile justice, and mental health to provide, pay for, and coordinate the care needed by these children and their families. The rationale for creating this program nearly 20 years ago was when we realized as a community too many youth were being placed out of their homes in residential treatment centers and other institutional facilities. They were staying too long, and more importantly, not getting better. We realized there was no magic service or therapy alone. We needed an overhaul of the entire design of the system, how it was structured, who was to be responsible to make sure services were adequate and effective, how funding streams could be pooled to ensure there was flexibility and adequacy, how we could expand our array of community service alternatives such as therapy, crisis services, mentors, tutors, and other services, and create new roles for families to play around making decisions as to what services and supports their child and family truly needed, and then wrapping services and supports around those families' needs.
The key components of Wraparound Milwaukee include first having well-trained and supported care coordinators who listen to what families need and want for a better life. Wraparound Milwaukee has 8 agencies located throughout the city of Milwaukee which employ care coordinators trained in the wraparound philosophy. Care coordinators provide weekly contact to families and are responsible for learning the family's strengths and needs, facilitating child and family team meetings, and creating plans which outline the support and services to be provided. The services are chosen by the families from our provider network, the second key component. This network has an array of over 70 types of services, traditional and non-traditional, located throughout the Milwaukee area. The third key component for support and success is our mobile crisis team. This team is available to all families in Milwaukee County 24/7 and is able to respond to emergencies in the family's home, child's school, or community. The fourth key component is family advocacy. Families United of Milwaukee not only provides family and educational advocacy, they play an integral role in our functioning by participating in committees, trainings, and assisting us with a variety of QA/QI tasks related to family satisfaction. And lastly, our QA/QI department is our fifth key component. Through the use of our tailored management information system called Synthesis, we are able to provide everyone involved in providing care to our families the information needed to monitor, evaluate, and continuously improve what we do on behalf of children and families. So why does all of this work? I believe what we do here at Wraparound Milwaukee works because of the strong commitment and passion for doing what is right by families. The values of the Wraparound philosophy, when taken seriously and incorporated throughout everything we do, has kept our leadership focused and assisted us in maintaining a strong and committed partnership between systems who are aligned on behalf of families.
years ago, families were hurt by the system, and they were told that I'm going to take your kid out of the home, and there was nothing families could do. Then we had Wraparound come along, which was a huge, intricate part of keeping families together. We go in families' home with the knowledge that we've gained from being involved in the system of care, and going out to the family's home and just making them feel like they are a part of something. They have a voice, they have the PhD on their child, they have the knowledge, and they need to be listened to, and they know what the total needs of their family. And that we're there not to disempower them or to talk for them. We're there to help them navigate, to help them understand what it is that they're going to need in an effort to be a true partner in the system of care, and not only that, to help other families that are navigating the system of care.
The hurt and the pain that you go through with trying to help your child to get where they need to go, and for me to go out and let another family know that, hey, you're not alone. Families United is here for you.
So that's what made me want to be involved and get involved with the other parents, because I know sometimes you just need somebody just to listen to you.
How it's set up to help that child, and whatever that child is going through, they get under that program. And I feel that I really love Wraparound, because I think what it denotes that it wraps around all the needs of that family.
I was actually hired to give back to all of the kids that are going through similar situations. I got involved with Wraparound Milwaukee when I was 17 years old. Some personal issues going on at home with my mom. It was really scary for me at first. I didn't know what was going on, but I had a really good team of people that kind of slowly went over, what was going to happen. I thought that I was never going to see my mom again, but they were able to work out visits, and eventually I got into independent living, and I was able to go on home visits with my mom. I was working one-on-one with a few people, like my transitional specialist or my care coordinator, and then I had a therapist and a counselor. It worked out really well. I was able to gradually turn my life around and make better choices with supports. I really want to go out and be an advocate for somebody and show them that there is hope for turning your life around. No matter what had happened in the past, there's always another road that you can take.
Wraparound Milwaukee has a variety of activities and resources to keep our youth involved and to build on their strengths. One of the favorite activities for the Wraparound program is our annual talent show, which celebrates their successes and demonstrates the personal growth they have developed.
All right, we're just getting ready for the rehearsals here. We got Sisters with Soul. They're incredible dancers. Why don't you come check them out? They're right around the corner here. Presenting Sisters with Soul.
Make me wanna sing. You make me feel it's just you and me. You give me butterflies. You make me feel like I can fly. You got my head in the clouds. You lift me off the ground, and I don't wanna come down.
I was real resistant. I was standoffish. I'm not trying to hear them. They can't tell me. They know so much and they can raise them themselves. But once I put my guards down and open my mind to what they can offer me, I feel like that's the best decision I can make. With the things that I asked of some of the Wraparound staff members, they was able to give me more resources to seek out to help me. They provided me with a parent assistant. Although I say, how can another person tell me how to parent my child? She don't really tell me how to parent my child, but she gives me that ability to let off some of my stress. Through Wraparound, I was able to find a good individual therapist who listens to what I want as far as the helps that my son needs. We do family therapy also once a week. With Jeremiah behaviors, it stresses on all of us, me, my daughter. So with family therapy, we're able to get those things out on the table. I have a team meeting every month with them, and that lets me know where my progress is and where I fall short at. You know, well, we haven't reached this time, we haven't reached this plateau yet, or we had this on our goal for this month. So if we reach it, then we'll set another goal. So most of those goals or challenges we have met and overcame.
The judges want to know what works. We don't want to keep seeing kids come into our courts over and over again. It's sort of like the revolving door. So working with Wraparound has given us that unique ability to stop that revolving door. I know that in terms of juvenile delinquencies or kids committing crimes, we've been able to reduce the rate of recidivism, kids coming back on new charges. In terms of the child welfare system, what we want to do is see kids reach permanency. And Wraparound has been able to work with us to achieve permanency for more children sooner.
Wraparound Milwaukee has seen positive outcomes in a variety of areas, including the rate of recidivism, commonly referred to as reoffending. A recent study showed just a 15% rate of reoffending by delinquent youth. This rate dropped from 30% in 2009. Even more impressive is the extremely low 4.2% rate of reoffending by Wraparound Milwaukee youth who are considered high risk. The high-risk group includes youth who have been adjudicated of sexual offenses or are victims of commercial sexual exploitation, as well as youth who have otherwise engaged in dangerous behaviors or have been a victim of complex developmental trauma. The goal of permanency is also being achieved, as 75% of youth in the program were discharged to a permanent setting with a parent, relative, adoptive resource, or subsidized guardian. The financial outcome is also very desirable. The average cost per month for a child in Wraparound Milwaukee is $3,700 per month. That compares to costs around $9,000 per month or higher in a state correctional facility or a residential treatment center.
I'm often asked, can this model be replicated? Every community is unique, and planning a Wraparound Milwaukee should be individualized to that community. However, there are lessons we've learned over the past 20 years and tips for how to create a successful model for your community. It will take a visionary group of system stakeholders from child welfare, juvenile justice, education, mental health, and advocacy organizations who can come up with a design for change based on the needs, existing resources, and strengths of your community. This work group will need to have the power to make changes in the structure of your current system and providers that truly serve families in your community. This group will need to be guided by a set of values and principles they can agree on. For us, it was and is the principles and values of Wraparound, which then became our model for treatment and care for children and families. The group will need to define the population to be served, as well as the funding streams that can be tapped to serve the families in the best possible way. Breaking down the funding silos, pooling monies, and seeing how much further those funds will go to serve children and families in the community can be a revelation to your system stakeholders. The leadership group will need to create clear goals and objectives with timelines for expected accomplishments and outcomes. We also found it valuable to do a pilot of our new model to assure the leadership group what we were proposing as a change not only worked, but created better outcomes for children and families than what existed in the past. From that pilot, we learned that we needed an organized way to collect and disseminate data, or the good news that kept us all motivated and moving in the right direction. And lastly, the key to success is creating a genuine way to receive feedback from the youth and the families you are serving, to continuously build and change as you go. Because in the end, it is about meeting their needs that counts.